Hey there, welcome to the channel. Today we're talking about something super important, but not discussed enough. Cervical cancer. I know. Not exactly the topic you were hoping for on your YouTube feed today. But stick with me. This conversation could literally save your life, or someone you love. So here's the deal. Cervical cancer used to be one of the biggest cancer killers for women in the US. But guess what? Those numbers have dropped dramatically, thanks to better screening, and this awesome vaccine we'll talk about later. But worldwide, it's still a huge issue with about 600 women diagnosed every year. Don't worry, this isn't going to be a boring medical lecture. I promise to keep this real, easy to understand. Let's dive in. So what exactly are we talking about here? Your cervix is basically the gateway between your vagina and your uterus. It's like the security checkpoint between the two. It's about 1 to 2 inches long, and actually changes throughout your menstrual cycle. Pretty cool, right? Cervical cancer happens when cells in this area start growing out of control. There are a few different types, but the main ones are squamous cell carcinoma. That's about 70 to 80% of cases, starting in the outer cells. Adenocarcinoma makes up about 20 to 25%, starting in the gland cells. Think of it like this. Imagine your cervix cells are like responsible citizens in a community. Normally, they do their jobs and retire, die off, when they're supposed to. But sometimes, they go rogue and start multiplying like crazy without dying when they should. That's cancer in a nutshell. Now here's the wild part. Almost all cervical cancer cases are caused by a virus called HPV, or human papillomavirus. And get this, HPV is super common. About 80% of sexually active people will get it at some point in their lives. Crazy, right? But don't panic. Having HPV doesn't mean you'll get cancer. It's kind of like how not everyone who gets a cold develops pneumonia. Most of the time, your amazing immune system kicks that virus to the curb within 1 to 2 years, and you never even know you had it. Out of over 100 types of HPV, only about 14 are the troublemakers that can lead to cancer. Types 16 and 18 are the real villains here. They cause about 70% of all cervical cancers. So how do you get HPV? Usually through skin-to-skin contact during sex. And sorry to break it to you, but condoms don't completely prevent it, since HPV can live on skin not covered by condoms. Here's a fun fact, that's not actually fun. You can have HPV for years without knowing it. There's usually no symptoms. That's why testing and screening are so important. But we'll get to that in a minute. So HPV is the main culprit. But certain things can make you more likely to develop cervical cancer if you have HPV. It's like having a leaky roof, HPV, during a rainstorm. Some factors can make that leak much worse. Smoking is a big one. I know, smoking shows up as a risk factor for basically everything. But it's true. The chemicals in cigarettes can actually damage the DNA in your cervical cells. Plus, it weakens your immune system, making it harder to fight off HPV. If you needed another reason to quit, here it is. Having a weakened immune system from things like HIV or medications that suppress your immune system after an organ transplant. Long-term birth control pill use, we're talking 5 years, slightly increases risk. But don't toss your pills just yet. They also protect against other cancers, so it's a trade-off. Having several full-term pregnancies or having your first full-term pregnancy when you're really young, before 17, slightly increases risk. Family history plays a small role. If your mom or sister had cervical cancer, your risk goes up a bit. Limited access to healthcare is a huge one. If you can't get regular screenings, problems might not be caught early. Think of these factors as adding fuel to the fire. HPV lights the match, but these other factors can turn it into a blaze. Here's some good news. Cervical cancer is usually super slow to develop. We're talking years or even decades from initial HPV infection to cancer. That's why screening is so effective. The cells go through changes called cervical dysplasia, or CIN, cervical intraepithelial neoplasia, before becoming cancerous. Think of it like a warning system. CIN 1. Mild changes. Your body will probably clear these on its own. CIN 2. Moderate changes. Getting more concerning. CIN 3. Severe changes. This is the danger zone before cancer. And if cancer does develop, it's staged from 1 to 4 based on how far it's spread. Stage 1, just in the cervix. Stage 2, spread a bit beyond the cervix. Stage 3, spread to the pelvic wall or lower vagina. Stage 4, spread to nearby organs or distant parts of the body. The earlier it's caught, the better your chances. Early stage cervical cancer has over 90% survival rate. That's huge. That's why those screening appointments matter so much. even when they're not the most fun way to spend an afternoon. Here's the tricky part. Early cervical cancer often has zero symptoms. Zilch. Nada. That's why waiting until you feel something wrong isn't a great strategy. But as it progresses, watch out for unusual bleeding, like after sex, between periods, or after menopause. And I'm not talking about a little spotting, though that can be a sign too. I mean bleeding when you wouldn't expect it. Discharge that seems off. Maybe watery, bloody, or with a funky smell. We all have discharge. It's normal. But if yours changes dramatically, or suddenly has an odor, pay attention. Pain during sex. Sex shouldn't hurt. So if it starts to, don't ignore it. Pelvic pain, back pain, or leg pain that can't be explained by your killer workout routine. Feeling unusually tired, losing weight without trying, or feeling full after eating just a little. In advanced cases, you might notice problems peeing or pooping, or one leg swelling up. Now, don't freak out. These symptoms can be caused by lots of other things too. Having one doesn't mean you have cancer. But they are definitely call your doctor kind of symptoms. Think of them as your body's way of saying, hey, something's up. Check this out. Alright, here's where you have power. Screening. Cervical cancer screening is one of the biggest success stories in cancer prevention. Seriously, it's cut cervical cancer rates by more than 50% in countries with good screening programs. Let's talk pap tests, or pap smears. I know they're not exactly a day at the spa, but they're so worth it. During a pap, your doctor collects some cells from your cervix and sends them to be checked for abnormalities. Then there's HPV testing, which checks specifically for the high-risk types of HPV that can cause cancer. So when should you get screened? Guidelines vary, but generally, start at age 21. Ages 21 to 29. Pap test every 3 years. GES 30 to 65. Either a pap test every 3 years, or a pap plus HPV test every 5 years. This combo testing is becoming more common. After 65, you might be able to stop if you've had normal results for many years. But this is just a general guide. Your doctor might recommend different timing based on your personal risk factors. Let me bust a myth real quick. You still need screening even if you've had the HPV vaccine, you're not currently sexually active, or you've only had one partner. The vaccine doesn't protect against all cancer-causing types of HPV, and HPV can lie dormant for years. I know. Getting a pap isn't anyone's idea of a good time. It's a bit uncomfortable, maybe even a little embarrassing, but it only takes a few minutes. Think of it like putting money in your health savings account. A small investment for potentially huge returns. How cool is it that we can actually prevent a cancer? Not many cancers can say that. But cervical cancer can. The HPV vaccine is the star of the show here. It protects against the types of HPV that cause most cervical cancers. The vaccine works best when given before any exposure to HPV, which is why it's recommended for kids around 11 to 2 years old. But you can get it through age 26, and in some cases up to 45. And parents, listen up. This isn't a sex vaccine. It's a prevent cancer vaccine. You wouldn't wait until your kid is in a car accident to put on their seatbelt, right? Same idea here. You're protecting them before they need the protection. Beyond vaccination, you can reduce your risk by practicing safer sex. Condoms help reduce but don't eliminate HPV risk. Limiting sexual partners. Not smoking, or quitting if you do. Getting regular screenings. Yes, I'm saying it again because it's that important. None of these are guarantees, but they all stack the odds in your favor. It's like wearing both a seatbelt and having airbags in your car. Layers of protection. If you're diagnosed with precancer or cancer, don't panic. There are effective treatments available, and the earlier it's caught, the more options you have. For precancerous changes, treatments are usually pretty straightforward. LEAP procedure uses a thin wire loop with electrical current to remove the abnormal tissue. Cryotherapy, freezing the cells, like putting an ice pack on a sprained ankle, but way more intense. Laser therapy, using light beams to remove the cells. Sounds like sci-fi, but it works. Conization, removing a cone-shaped piece of tissue. These procedures can usually be done in your doctor's office or as outpatient procedures. They might be a bit uncomfortable, but most women recover quickly. For early-stage cancer, options include surgery, ranging from removing just the cervix, leaving the uterus intact for future pregnancy, to more extensive surgery depending on the case. Radiation therapy, sometimes a combination of treatments. For more advanced cancer, treatment usually involves combination of chemotherapy and radiation, more extensive surgery, newer treatments like targeted therapy and immunotherapy. I know this all sounds scary, but cancer treatment has come so far. Many women go on to live long, healthy lives after cervical cancer treatment. And remember, the earlier it's caught, the better the outcome, which circles back to the importance of regular screening. So there you have it. Everything you need to know about cervical cancer in a nutshell. Let's recap the most important points. HPV causes almost all cervical cancers, but most HPV infections clear up on their own. Regular screening can catch changes before they become cancer. The HPV vaccine can prevent most cervical cancers. Early detection means better outcomes. Even if you're diagnosed, there are effective treatments available. Remember, taking care of yourself isn't selfish, it's necessary. You can't pour from an empty cup, and you can't take care of others if you don't take care of yourself first. Thanks for hanging out with me for this important conversation. Drop a comment below if you have questions, and don't forget to like and subscribe if you found this helpful. Until next time, take care of yourself. You deserve it.